Hello everyone, this is me Alquan, and before we get back to this video, I want you to go ahead and like and subscribe. Let's get back to this video. Hello everyone, this is me Alquan. Welcome to another episode of the official Alquan the Genius Guide. I'm going to talk about a sedation that is used for sleep while doing surgery called anesthesia. Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical or veterinary purposes. It may include some or all of analgesia, relief or prevention of pain, paralysis, amnesia, loss of memory, and unconsciousness. An individual under the effects of anesthetic drugs is referred to as being asthenized. General anesthesia suppresses central nervous system activity and results in unconscious and total lack of sensation using either injected or inhaled drugs. Sedation suppresses the central nervous system to a lesser degree, inhibiting both anxiety and creation of long-term memories without resulting in unconsciousness. Regional and local anesthesia block transmission of nerve impulses from a specific part of the body. Depending on the situation, this may be used either on its own or in combination with general anesthesia or sedation. Local anesthesia is simple infiltration by the clinician directly onto the region of interest. Peripheral nerve blocks use drugs targeted at peripheral nerves to anesthetize an isolated part of the body, such as an entire limb. Neuraxial blockade, mainly epidural and spinal anesthesia, can be performed in the region of the central nervous system itself, suppressing all incoming sensation from nerves supplying the area of the block. In preparing for medical or veterinary procedure, the clinician chooses one or more drugs to achieve the types and degree of anesthesia characteristics appropriate for the type of procedure and the particular patient. The risk of complications during or after anesthesia are often difficult to separate from those of the procedure from which anesthesia is being given, but in the main, they are related to three factors: the health of the individual, the complexity and stress of the procedure itself, and an anesthetic technique. Of these factors, the individual's health has the greatest impact. Major preparative risks can include death, heart attack, and pulmonary embolism, whereas minor risks can include postoperative nausea, vomiting, and hospital readmission. Some conditions like local anesthetic toxicity, airway trauma, or malignant hypothermia can be more directly attributed to specific anesthetic drugs and techniques. Different types of anesthesia affect the endorphins differently. The goal of anesthesia is to achieve the endpoints required for the given surgical procedure with the least risk to the subject. Anesthesia is not a direct treatment in its own right, but rather it facilitates other treatments, diagnosis, or cures which would otherwise be painful or complicated. The best anesthetic, therefore, is one of the lowest risk to the patient while still achieving the endpoints required to complete the procedure. Safe anesthesia care depends greatly on well-functioning teams of highly trained healthcare workers. The medical specialty centered around anesthesia is called anesthesiology, and doctors specialized in the field are termed anesthesiologists and include anesthetic nurses, nurse anesthetics, anesthesiologist assistants, anesthetic technicians, and so on. International standards for the safe practice of anesthesia, jointly endorsed by the World Health Organization and the World Federation of Society Anesthesiologists, highly recommend that anesthesia should be provided, overseen, or led by anesthesiologists, with the exception of minimal sedation or superficial procedures performed under the local anesthesia. During the surgery, anesthesiologists closely monitor the patient's vital signs, including the heart rate, blood pressure, and breathing. They also ensure that the anesthesia is working effectively and adjust it as needed. Anesthesia is a medically induced state of unconsciousness and loss of sedation that is used during surgery and other medical procedures. If you was to have surgery, don't think that when they put anesthesia on you, you're going to be dead. You're not going to be dead. It feels like going to sleep. It feels like being in a state of sleep, being deep in your sleep. So don't think that anesthesia can make you die while they do your surgery. That's not what it's for. It's not to kill you. It's there to make you sleep so that you won't feel no pain as they're doing the surgery and while they're doing the surgery. So that when you're in the state of unconsciousness while you're sleeping through the anesthesia, you'll feel less pain, meaning you won't be able to feel no pain in your body while they're working on your body. This is me, Alquan, and I hope you get the picture of this stuff that I'm talking about. This is very important if you want to become a doctor. Learn about what anesthesia does. Understand what anesthesia does. Keep learning and you will know a lot. And once you have learned so many things, you'll be able to learn a whole lot more. And remember to like and subscribe to my YouTube channel, and I will be happy if you do so. Hello everyone, this is me, Alquan. And if you like this video, I want you to go like, comment, and subscribe to my YouTube channel. Remember, keep learning and you will know a lot.